So now I'm going to demonstrate trauma assessment to try and determine DCAP BTLS, which is deformities, contusions, abrasions, penetration, burns, tenderness, lacerations, and swelling. We first arrived on scene. Of course, proper PPE must be taken, so normally I would have gloves and if anything else, depending on the situation. Scene size up, is my scene safe? We're looking for more noise or mechanism of injury or nature of illness. Number of patients, here I have one patient. Do I need additional resources such as the fire department or ALS? Of course, we're going to consider C-spine, and if our patient is conscious, we could go through OPQ or ST. So first thing I'm going to start with, I'm going to go on the side and start with the skull. So I'm going to run my hands behind the head, constantly checking my gloves to see if any blood is present. I'm going to go through and feel for DCAP BTLS. After I'm done with the head, I'm going to go to the neck looking for jugular vein distension, stoma, anything like that. Go through, place my hands on the chest to look for chest rise and fall. After that, I'm going to go down and right around here, I don't have my stethoscope with me, but I could do breath sounds, see if there's anything wrong with respiratory. When I get down to the abdominal region, I'll check all for quadrants. Again, feeling for DCAP BTLS. Going down the body. Now getting to the femoral region, feeling all around. Again, looking for DCAP BTLS. Straighten it like that, Mom. Like that. So then I'm going to get down to the legs. Continue feeling around. Still looking for DCAP BTLS. Go all the way down to the feet. For legs, you do one leg at a time. So as you go down, I'm going to feel for anything, feel under. Anytime I'm feeling under the body, I'm checking to see if I see any blood present on my gloves. I'm going to get down to the feet, check for distal pulse. I'm also going to check for PMS. So what toe am I touching?
Big toe.
What toe am I touching now?
Little toe.
All right. Again, you're going to feel for the other lower extremity, all the way down checking for DCAP BTLS. Check for a pulse again. Toe am I touching?
Big toe.
Toe am I touching?
Little toe.
Okay. Then we're going to go up. We're going to check one arm at a time. Bring your other arm down. Go down. Checking under the arm. Constantly checking to see if I have blood on my gloves. I'm going to go over, check for radial pulse. And then again, of course, check for PMS. What finger am I touching?
Thumb.
Finger am I touching?
Pinky.
Can you wiggle your fingers? Okay. And of course, without ever crossing over my patient, check the other side. Go down the arm. Feeling for a pulse. Finger am I touching?
Thumb.
Finger am I touching?
Pinky.
Can you wiggle it? Okay. Then we're going to roll the patient over. Can you just roll over on your side? And check the back side. Feeling all down. Checking for DCAP BTLS. All the way down the back side. Checking my gloves for any blood. And that's going to complete the trauma assessment.